And so I think that's really interesting too, because I've been here 20 years, right, at Buxton, and I grew up in our retail vertical, and then started working in the healthcare vertical in 2014. Then going to Mercy, it was like when you would talk to healthcare leadership, it would be like, okay, what are you trying to accomplish? And obviously growth was important, but when you would talk to them, it was very old school, inefficient ways of doing things, potentially putting large capital at risk with a bad process of making decisions, which was very similar to what I saw when I first started at Buxton in retail. And then so in those conversations, you'd sort of say, hey, okay, if you're trying to accomplish these things, you're trying to optimize your planning, you're trying to maximize performance of existing locations, you're trying to find the best places to put services, to put new locations. What if you could see things this way? And was starting to just talk to them about how sort of our retail solutions were from an outpatient or an ambulatory standpoint. Like, retail is that, just not the healthcare component. And they were like, oh my gosh, you could do it like that. And it was this great evolution of the solutions of, hey, let's blend our retail understanding with getting really smart about healthcare and data and smart people bringing in like you, all wrapped around the understanding of a patient as a consumer. And that really has created, I think, something that's been transformative for healthcare companies as they look to expand.
I think it is that when you have conversations in healthcare about the fact that potential patients have choice, right? And understanding who would choose you, who would need your services, right? And sort of that ability to then also thread in all of the healthcare data that we have with those solutions, it's really been an awesome process.